Collaboration for Advanced Practice Nurses by Kiera Benton and Jenna Burns. What is collaboration? Collaboration is a process by which nurses come together with patients and other healthcare members and form a team to solve a patient care or healthcare system problem, with members of the team respectfully sharing knowledge and resources. Advanced practice nurses will collaborate with physicians, nurses, social workers, pharmacists, and many other disciplines to provide holistic, patient-centered care. As new providers, collaboration will be critical for a number of reasons. We will be learning a lot of new things in a short amount of time. Therefore, we will not know everything there is to know to properly care for our patients. We will have to heavily rely on our collaborating providers for a long time before we develop adequate skills to work on our own. Even when we are trained, healthcare providers never truly work alone, as we are always collaborating with others regarding patient care. Working closely with members of the interdisciplinary team will allow nurse practitioners to get a better understanding of the different perspectives that other team members have to offer. Doing this can help reduce errors, promote continuity of care, and improve patient outcomes and satisfaction. Objectives are to define collaboration, the application of collaboration to improve patient care, develop strategies for personal and professional development, and discuss issues that arise in advanced practice nursing. Collaboration is their strategic approach to integrating expertise from multiple team members. Patient satisfaction has become an indicator for measuring quality and is linked to clinical outcomes, patient retention, and patient-centered care. Research shows that collaboration improves patient satisfaction, reduces medical errors, and decreases provider burnout. Collaboration can also enhance coordination, which is critical in both primary care and mental health care settings where patients require long-term management. Nurse practitioners have improved quality and safety metrics, as well as patient and staff satisfaction that can provide continuity of care. There are several barriers that exist, such as a lack of understanding of the nurse practitioner's scope of practice, power struggles between physicians and nurse practitioners, and communication challenges that can significantly affect collaboration. 4 characteristics of effective collaboration are development of role clarity, interprofessional trust and confidence, possessing the ability to overcome adversity and personal differences, and collective leadership. To help overcome barriers, organizations need to have clear policies that outline the nurse practitioner's role. Providing education for all members of the interdisciplinary team can help them to better understand roles and promote trust between one another. Institutional expectations can provide a structure that facilitates interprofessional communication and relationship building. There are 4 dysfunctions within team communication that include the absence of trust, fear of conflict, lack of commitment, avoidance of accountability, and inattention to results. Establishing trust within the interdisciplinary team fosters open and effective communication regarding patient care. This also allows team members to feel comfortable talking about disagreements if they arise. How do we apply collaboration in a professional sense as advanced practice nurses? Collaboration is about actively engaging with other disciplines and professionals to provide patient-centered care. One example is interprofessional collaboration. Interprofessional collaboration brings multiple disciplines together, such as nursing, therapy, social work, and medical doctors for a common goal, improving patient outcomes. According to Johnson & Johnson, interprofessional collaboration brings multiple disciplines together to provide a coordinated team-based approach to patient care. When multiple disciplines collaborate regarding patient care, it has been shown to enhance patient outcomes as well as reduce burnout between the disciplines. Another form of professional collaboration is mentorship among APRNs. According to the American Nurses Association, mentorship within the advanced practice nurse role is a valuable form of collaboration. Having a mentor aids in reducing stress with role transition, builds professional connections, and aids in improved problem-solving strategies. Being a mentor allows you to gain insight from diverse generations, analyze your own communication skills, and renew your compassion for the nursing profession. Personal application of collaboration includes 3 elements: communication, respect, and accountability. Communication involves self-awareness. It is important to understand how your tone and approach with others can affect conversation. Effective communication helps prevent errors and builds better relationships with all members of the healthcare team. Respect is recognizing all members of the healthcare team as valuable. This allows individuals within the team to speak freely without fear of judgment, improving decision-making and patient outcomes. Accountability includes following through with tasks and demonstrating reliability. These actions strengthen trust among colleagues. According to Harvard Medical School, When healthcare professionals understand each other and maintain open and respectful communication, strong team bonds are formed, improving patient outcomes and supporting a safe and thriving working environment. Collaboration is a skill that must be developed and practiced throughout your career. There are 3 effective methods to aid in strengthening and using collaboration in an advanced nursing practice role: interprofessional education and training, communication tools, and reflection practices. These methods enhance care coordination skills, builds trust among patients and colleagues, as well as improves patient outcomes. Interprofessional education includes learning with and from other healthcare disciplines with the goal to improve collaboration. One way interprofessional education helps develop collaboration is through workshops where multiple disciplines work together to collaborate on a case as a team. Interprofessional trainings include simulation-based learning. This allows participants to role-play real-life scenarios, practice collaboration and communication among other disciplines, thus allowing better understanding of each other's scope of practice. Understanding others' scope of practice reduces role confusion and promotes respect among team members. According to an article review by Samario, having a diverse group of healthcare professionals engaged in IPC with different backgrounds, insights, and perspectives increases the chances of generating unique and innovative solutions. Communication is crucial for effective collaboration in healthcare. Standardized tools help ensure effective communication and collaboration. Situation, background, assessment, and recommendation. This is an effective and concise tool to use when collaborating with other disciplines about patient care. This tool is proven to reduce errors and ensure all members of the healthcare team are up to date on patient's condition. Background, effect, trouble, handing, and empathy is an important tool for patient-centered collaboration. This tool allows for open communication between the provider and the patient and aids in understanding the patient's emotional state, allowing providers to provide care with empathy and understanding. Ticket to Ride is a tool important for collaboration between disciplines when a patient is being transferred or moved to other units. This ensures that all disciplines involved, such as radiology, transport team, or nurses, are all informed of the patient's needs, precautions, and risk. This communication tool ensures accountability and coordination between the disciplines. According to the HIPAA Journal, by using these standardized tools, collaboration improves by reducing miscommunications, promoting consistency, and supporting safety and teamwork amongst different disciplines. Reflection is a crucial method of developing collaboration skills. Reflective practice activities such as journaling, weekly team meetings, and receiving feedback from peers strengthens teamwork and promotes self-awareness. Reflection allows practitioners to adjust their approach with the interdisciplinary team, ensures communication is effective and productive, creates an open and honest environment for the healthcare team, and supports continued learning from mistakes as well as success. What are some issues with implementation of collaboration? These can include a limited understanding of the nurse practitioner's role among team members, certain state practice barriers, or a lack of support from the company or collaborating physicians or providers. The lack of knowledge of other professional skills, reluctance to change, and the absence of interprofessional education and curriculums has been reported as hindering practice of interprofessional collaboration. Depending on the state laws, nurse practitioners can either work alone or will have to collaborate with a physician to prescribe medications, order diagnostics, and make agreements on patient care and treatment. If there is a lack of support from the collaborating physician, this can make it very difficult for the nurse practitioner to do their job. Strategies to overcome barriers. Organizations can help educate all members of the interdisciplinary team on the role of all the team members, specifically the role of the nurse practitioner and how they can help the team and improve patient care. It is important for the nurse practitioners to also understand the other roles involved, developing strong communication skills, having regular staff huddles, and establishing goals can strengthen collaboration for the advanced practice nurse and the interdisciplinary team. In conclusion, collaboration is essential for advanced nursing practice. Through collaboration, healthcare providers combine their unique knowledge and skills to deliver holistic, patient-centered care that improves safety and patient outcomes. Interprofessional education allows other disciplines to learn from each other and build mutual respect. Communication tools such as SBAR, BATHE, and Ticket to Ride ensure clear and effective communication when collaborating with multiple disciplines. While barriers do exist, such as unclear role expectations and legislative restrictions, they can be reduced through continued education, appropriate communication, and shared established goals. Effective collaboration is key in the advanced nursing role. Collaboration fosters open communication, mutual respect, and a shared accountability, which leads to improved patient outcomes and professional development.